A core principle of the work of the Murdock Trust is that we look to those on the front lines of our communities to tell us the challenges they are facing. Many of our communities live in very rural settings. Over 60% of rural Americans live in designated mental health provider shortage areas.
Consistently across the U.S., rural communities struggle to find access to health care, and that includes mental health care.
There's often an attitude or a culture around what it means to be self-sufficient. Often that will exacerbate the feelings of loneliness.
I think the number one challenge that we have at this point is staffing. So the overall pool of potential staff has shrunk.
1 in 5 suffer from mental health and substance use.
And out of that, less than 50% seek services. That's including urban areas. When we go to rural areas, the number is more like 35%.
If kids don't get the care they need for mental health, they have lower graduation rates, they have a lower chance of going to college, they tend to have jobs that are lower paying, they have a higher chance of having heart disease, diabetes.
Jack Murdock was a pioneer with regards to mental health. He was one of the first champions of mental health care for his employees at Tektronix. Jack knew that a person with strong, healthy, resilient mental well-being would not only perform better at work, but show up better to the people around them and offer more to their community.
The suicide risk here across Montana has been historically one of the top 3 highest suicide rates among youth in the country for like the last 40 or 50 years. Suicide is the second leading cause of death, not only among rural youth, but all youth who are 10 years old and older. We're talking about hundreds of thousands of kids that are attempting suicide every year.
I didn't know how to tell people that I was struggling, and I didn't know how to tell people that I wanted to end my life. I felt like I was starting to get swallowed from the inside out.
We need to find the kids that need help. And so I decided in 2020 to co-found RBHI to bridge that gap between things we know from doing research to getting those evidence-based programs to rural communities.
Valley City's behavioral health care, we focus on substance use, mental health, and many other support services that we provide all throughout King County. It was created because of the demand and the foresight that behavioral health is an issue. We provide psychiatry, therapy, case management, counseling, withdrawal management, supported employment, medically assisted treatment, inpatient facilities, low-income housing, supportive housing, supported employment is our school-based program. We move beyond that. We go to where the clients are, where the needs are, and this is where I think we thrive.
Here's our mobile clinic. We purchased a Sprinter van and then retrofitted it for our needs. We're trying to create a new model, and this new model would meet people where they're at. The van will act as a physical extension of Valley Cities and be able to engage people where they're at.
We have kids take a screener that asks them about depression, anxiety symptoms, and suicidality. Once they're identified, they're connected with a mental health professional at a school the same day they take the screener.
I was a child. I didn't know what was going on, and I didn't know how to help myself. I think that was the first time that I was like, okay, I can do this adult thing. I can keep going. I can make it through this.
So when people have access to quality behavioral health care, it's transformational. To see people's quality of life improve, to go from, hopelessness to having hope, that's huge.
We've screened over 11,000 kids this past school year. Once we know that these kids are struggling, we have an opportunity to take action. By the end of school year 2024-2025, we hope to be delivering our intervention in all of the public schools in Montana. And once we have scaling down, we'll be able to go nationwide. We empower kids to take control of their lives and learn skills so that they can maneuver through stressful situations for the rest of their lives.
3 out of 4 people, 3 out of 4 recover from mental and substance use abuse through services. With treatment, everything is possible.
Ultimately, we know that more needs to be done, and we want to support those who have the most innovative and sustainable solutions, because we know that works and we know it matters.